Our community assessment project is entitled Prescription Drug Abuse Among Youth Ages 12 to 18 in the Native American Population in Rowan County. This is part of a project for Nursing 406 in Community Health Nursing. So basically, we decided to pick this particular group as a diverse population within the community. And you might ask why, and this is based on the State of Rowan County Health report, which is called the SOTCH, that identified three prior health assessment priorities which surfaced: tobacco abuse, prescription drug abuse, and obesity. So if we look at this chart, we can see that opiate poisoning has been steadily increasing in Rowan County. So this is part of the concern for what's driving the project. And if you look at the demographics of Rowan County, roughly about 0.4% of residents are American Indian, based on the Rowan County NC.gov reference. So, although that American Indians are really a minority population in terms of absolute numbers, we think that they have a socioeconomic risk that may lead to vulnerability in terms of prescription drug abuse. And part of the reason for that is that 3 out of 10 American Indians, primarily children under the age of 18, live in poverty. So this is a big risk factor. Also, 18% of American Indians do not have health insurance. And they are basically among the highest representation of poverty rates among all races. 1 out of 5 high school male American Indians have taken prescription medications that were not prescribed to them. And American Indians have the highest rate of unintentional overdoses and deaths due to prescription opioids than all other races. So if we look at this chart below in this slide, we see some interesting information. Basically, American Indians have one of the highest rates of deaths per 100,000 residents due to prescription opioid overdoses. So this sets the stage for our windshield survey. And actually, I did take a drive through Salisbury, North Carolina, within Rowan County, and this just shows us in the car as part of this snapshot. And I did want to recommend, just call attention to the fact that one of the main academic areas of the county is the community college, Rowan Cabarrus Community College, and I just took a few pictures of that school. And also a few pictures of the housing. And what you could tell is that the housing, and this is just a typical neighborhood, I would just say it was within 5 miles of the community college, is lower to lower middle socioeconomic class, and just you can see the houses with and just the state of what the economy looks like. And here's some more houses within the local community. So, some things that I learned from the windshield survey are that there are common characteristics of people. Basically, they have a casual lifestyle. When usually a lot of the residents do not work in Rowan County. They travel to larger cities. They have, just looking around town, most people do appear to be overweight or obese. Within the city and the county, there are a lot of social venues such as coffee houses, restaurants, churches, and parks. And church attendance is a big part of the community, both for the social activities as well as the support system, as well as Boy and Girl Scout and Vacation Bible School. And it's sort of a slow-paced rhythm. It's not a fast-paced town. So basically, and people are really social and will talk to strangers that are in the street. So, houses do vary greatly. I did go within the community college area, but many are of the lower SES or socioeconomic status. And there is public transportation, but it's not really widely available, so most people do drive, and 35% of residents will work outside of the county. And they do have, I listed some statistics for healthcare, but again, there's an issue with healthcare since only 11%, since 11% of the residents will have limited access, to food in a grocery store, and experience food insecurity. Even with the healthcare, not all the residents are able to seek primary care. So in Rowan County, there are two main hospitals. There's the Navant Health Center as well as a VA hospital. There's also a family health clinic that provides a lot of different services. And for the newspaper, there's a local Salisbury Post and a lot of retail trade in the area. Okay, for social services, there is the Food and Nutrition Service Program. There's Medicaid, and there is also a Medicaid Savings Program. And there are two Rowan County community clinics that have either free or sliding scale services. So, to find out a little bit more beyond the windshield survey, we did try a few options for doing a questionnaire as one of our informant interviews. And I posted a questionnaire with several questions for representatives from the Rowan County Health Department to answer. So the first one I asked was about whether they felt substance abuse is a major problem in Rowan County, and I had 3 major contributors within the health department, and they all said they strongly agree. So we know this is a big problem. And then I further asked them what they felt the major contributing factors are. And so I got a variety of answers, but I listed what they respond with: family history of abuse, peer pressure, family life, personal stress, and also physicians not using proper prescribing protocols. Then I asked, how can nurses and doctors curtail this problem? And they said that being judicious in prescribing, and also combining narcotics with NSAIDs and other strategies. And also, patient education is very important. So patients need to understand how to appropriately take their meds, understand that if they are prescribed narcotics, it needs to be short duration, and that they need to be weaned off it, and so forth. So, as we continued with the conversation, I asked some more details about what could be done, and one respondent, Carrie Martin, said that doctors and nurses need to be more educated on the signs of abuse. So, they need to be really cognizant of how the patients are presenting and have open discussions. So basically, knowledge is power in this scenario. Also, there's legislation. Nina Oliver did mention that the STOP Act, which deals with narcotics, should be, and also the prescribing practices of narcotics should be enforced at each clinic. So basically that puts hard stops on how much a patient could get and how much a prescriber can prescribe at a time. Okay, and then I also asked about what treatment centers are available. So Carrie Martin mentioned that Daymark Recovery Services, Rowan Treatment Associates, and Nazareth Child and Family Connection are some sources. Also, there are different programs that accept Medicaid and offer sliding fee scales to inpatient and in-home programs. I do have those listed, and Teresa Lowry did provide me with this list. Okay, and we also had another key informant that was interviewed, Lisa Nichols, who is a med-surg nurse manager from Navant in Rowan. And also this was an in-person interview, in contrast to the other questions, which were a survey sent online. So this in-person interview asked some key questions. One was how frequently patients are encountered that are addicted to prescribed medications. And it's pretty striking, but she said 1 out of 5. So that shows that 20% of our inpatient hospital patients have this problem. Also, she was asked what impact does drug addiction have on her work. And so basically, she did advocate for nurses educating patients for alternative types of pain relief before offering or giving into, oh, it's like you have you know either like morphine or Dilaudid every hour or every 2 hours, and instead of saying, oh, it's exactly an hour or exactly 2 hours, let me give this, but to give all the other alternative pain meds such as NSAIDs, also looking at other techniques such as guided imagery, music, things of that nature. And she was also asked what could be done to help those that are addicted in the community. And so anxiety, we need to look more carefully at what meds are being prescribed for pain and anxiety, and even sleep meds, which could be addictive too. And non-pharmacological methods are very key. Also, controlling pain with the smallest dose possible, and weaning is appropriate. So she was asked about groups of people in Rowan County, and basically whose quality of life might not be as well, and that could be a risk factor for abuse. And she did say that there are basically, if you're the low-income sectors of the community seem to fare the worst and be at most at risk. And then she was further asked why. So if you're of low income, you may not have access to health care. You may also have a lot of difficulty with securing rides and transportation to both doctor appointments and to pharmacy. And so she was asked specifically for what is the most critical health and quality of life issue in Rowan County. And hands down, she said mental health. So mental health is really very key, linked to substance abuse, and a lot of people that have substance abuse issues, it might stem from mental health. So she did say that was a big focus, mental health, as well as lifestyle changes. Okay, and then I also further spoke to another group that is involved with substance abuse prevention, a group called, abbreviated with the acronym WISE UP, YSUP, is Youth Substance Prevention Group in Rowan County, and they focus on youth, particularly the 12 to 18 range. And they look at substance abuse. They also look at alcohol, but I did gear my questions to one of the key informants, Liz Tennant, who is basically the project coordinator of WISE Up, to some key determinants for what's going on. And so I asked her, what are the main contributing factors to prescription drug abuse among youth in Rowan County? And she said that favorable youth attitudes, meaning it's accepted, it's the norm. Also, that it's, the social availability of drugs, and the cultural and community norms. So basically, it's a norm for the society, and so because it's a norm, it is not discouraged. So mental health issues, she also stated that mental health issues are probably the stem and the root and the source of this problem are not adequately addressed. She specifically mentioned that there's a stigma associated with having mental health issues. It's something that people don't talk about, and therefore it's not really addressed. And she stated there's a general lack of rigor mental health awareness and checkups for both children and adults. So WISE Up is an interesting group in that they last fall received a really large sum grant. It's a $625,000 5-year grant, and the purpose of that is performing a very comprehensive community assessment that will assess the prevalence of drug substance abuse, and look at who's affected, look at the causes, and look at what could be done. And this was just started, granted in the fall, and then goals for 2018 are looking at methodology for conducting basically a comprehensive community health assessment. So basically what I did, but on a much, much larger scale, much more comprehensive, and trying to find out what is the problem, what is the extent of the problem, who is affected. And then basically the following year we'll be focused on deploying interventions to help with substance use prevention. So basically once we identify this problem, a big push is to how to talk with youth and educate them as well, because education is a very, very big part of prevention. Okay. So, what are the current goals for 2018 to 19? One of the goals is to have a public forum that will both be a safe place and a venue for everyone in the community to be educated and aware of what's going on, to talk about the problem, to inform the public, to give them resources, and to really rally everyone for support. And actually just a couple weeks ago they had a second annual Rowan Opioid Forum, and that actually really launched a lot of the Wise Up initiatives for 2018. And one thing that Liz Tennant mentioned, that social media can be a platform to help with assessments and education. And in addition to the opioid forum, and again one will be held next year also at this time, is that sporting events are a huge part of the social platform within Rowan County. She mentioned baseball is huge for summer months, and so there's a league called the American Legion baseball game, and this would be a great venue to educate the public about opiate abuse, especially in Rowan County, because that's just a huge draw for the community and part of their social framework there. So what does what community partners does Wise Up partner with? And actually she did mention that there are 12 total sectors within the community that form an alliance, including law enforcement, local group organizations, government, civic and volunteer groups, schools, parents, healthcare leaders, substance abuse prevention organizations, local businesses, news, media, and religious groups. And looking at religious groups, right next door to Wise Up in Rowan County, there is a church. It's called Maupin Avenue ARP Church, and Randy Foster, who's a pastor, is integral. He serves on one of the he serves on the religious sector committee of Wise Up and ministers to youth in the community. So actually this here came from my stakeholder meeting and is part of my the drive-through window assessment. And actually Wise Up looks, if you look at the far right, that's what it looks like. It actually looks like a residential community in a little house there. If you look in the door, it says United Way. And then on the left, we see some of the ladies I met with. I am on the far right. Far left is Liz Tennant. She is the project coordinator. And in the middle there is Miss Gail Cece, and she's the project assistant. And then right next door is a church, Maupin Avenue Church, that does minister to youth. So once we did our drive-through window shield survey, we next went on to do a secondary analysis to look at our community to find out something a bit deeper about the community. So we looked at the demographics, and we see that the community is primarily Caucasian, 80%, 16% African American, and I would say 1% or less is the minority population of American Indians. And so we could see that that population, that only 83% have completed high school. 17% of Rowan County residents have a bachelor's degree or higher, so that pretty much delegates a lot of the community to a lot of trade occupations and more blue-collar occupations than white-collar occupations. And because of that, income levels are not that high. There's 18% poverty rate, and the mean household income is about 44,000. However, 16.5% will live below the poverty line. So access to healthcare, medical and mental health is an issue for Rowan County. So, and also another issue is that there are only really 5 main employers, so that does drive where the community can secure employment. Also, we do have a lot of different businesses within the community, and depending on the source that you get, Native Americans will be 0.4 to 1%. So different references will give a slightly different number depending on how they acquired their data and did their surveying. So with Native Americans, their top 3 health issues are heart attack, stroke, and cancer. Tobacco abuse is widely seen in that community, but after tobacco use, drug abuse and prescription drug addiction are really the leading health problems. So that drives our study from the secondary analysis. The poor health of Native Americans is associated with a decreased education level, unemployment, and low incomes, with 21% living below the poverty line. And a family of 4 for Native Americans try to live off of $21,000 a year. 28% do not have health insurance and cannot see a physician. And so they have much higher mortality and morbidity rates than Caucasians. Because the opioid epidemic is such a problem, in 2011, Governor Roy Cooper declared this basically an epidemic. 12,000 residents in North Carolina have lost their lives to overdoses in that 1 year. And so also a big statistic is that Native American men had the highest death rates of all ethnic groups. And so with 8 deaths per 100,000 from prescription opiates, so oxy, fentanyl, and so forth. So basically, if we look at everything that we've gathered from our assessment data, we would say that we've assessed the socioeconomic and social considerations that affect health, and we have identified American Indians as an at-risk group. Our key findings are, of course, the decreased educational level, high rates of unemployment, and low incomes. Also, the high death rates of Native Americans. And we also identified youth, specifically ages 12 to 18, as being high risk, based on the fact that 1 in 5 high school male American Indians have sought out and taken prescription meds not prescribed to them. Okay, so now I want to talk about the community health status. Community health is a little bit different than just individual health, in that it involves nurse and community interacting together. So basically the goal of this is to achieve a change in the community that's going to promote the health of that community. Okay, so basically this is not just a one-time sort of interaction. It's an ongoing process where a nurse will interact with the community and make sure that that they do have a partnership. So the community health has 3 dimensions. There's status, structure, and process. Status is going to be a measure of community health outcomes, and it could be social, emotional, and biological components. And biological indicators of community health will include life expectancy, mortality, and morbidity. The emotional components have to do with a lot of mental health can deal with it, the emotional components. And social, for example, are the social structure, but also how safe neighborhoods are in terms of crime. Biological indicators basically anything biological that can deal with what predisposition to disease and health. And we see that American Indians will have a lower life expectancy than other races, higher incidence of diabetes and chronic liver disease. Emotional needs, okay. We have issues with mental health resources within the community of Rowan County. Quality of life measures have been studied for American Indians, and they do fare worse than African Americans and Caucasians, including poor mental health. And the social environment is important, including crime. American Indians are at a higher rate of homicide than Caucasians, in fact, 52% higher. And also American Indians are at 12% higher incidence for unintentional injuries compared to Caucasians. So community health forms a structure, basically, you know, resources and services within the community. We have looked at the structure, including the Rowan County Health Department, medical centers, community care clinics, etc. However, even though we have a lot of resources within Rowan County, there are no specific resources for American Indians. But there are youth programs, so like Wise Up Rowan and then Daymark. And so one goal with the structure is to be more inclusive to diverse groups, including the American Indians. And then the process perspective of community health looks at how different organizations can basically join together to meet community needs. So basically, one area that needs focus is on all of these groups working together. Okay, so the strengths of the community. One major strength is that there are 12 total medication drop boxes in Rowan County. So that is a strength. Also, there are state, local, and national support systems for prescription drug abuse. The one that I researched the most was the Wise Up Community Prevention Program that has 12 sector support system. Also, the Rowan County Board of Commissioners has a opioid planning committee. And also the Controlled Substance Reporting System, or CSRS, is used to prevent doctor shopping for controlled substances by patients. And the Rowan County Opioid Forum Roundtable that just occurred in May does help with public awareness, education, and being a sounding board. So this is just a advertisement showing the medication drop box locations. And then I mentioned the 12 sector support. So, and listed some key people that are involved within these sectors. And one thing that Liz Tennant didn't mention is that there's a lot of support and a lot of groups, but one weakness is that a lot of these support groups are staffed by volunteers that have a lot of other responsibilities on their plate, and so they may not have, be driven to help, but they may not have the desire, and they may be, not have, full-time capacity to work on some of these issues. And also there needs to be a way that resources can cover everything that's needed, but not duplicate efforts, and also not leave areas of gap where there are needs in the community that are not being addressed. So also I looked at, listed here, some local and some state and national support programs. The Wise Up Rowan and serves, as you can see in this lower right hand corner, quite a few cities within Rowan County. And then like SAMHSA is for Substance Abuse and Mental Health Services Administration, and the Center for Prevention Services in CAGA are national advocacy programs. The Youth Service Bureau is a local program. Also, I did have here a map of North Carolina, and in yellow there are some counties that have specific leadership programs that are dedicated to prescription drug abuse. And one thing that was interesting is sort of in the middle of the state, you can see Rowan County does have a leadership forum. And so, but there are neighboring counties, like I live in Forsyth County, I work in Guilford County, that don't. So they could serve a model to help neighboring counties. And one of the weaknesses, some of the weaknesses that I found, especially with talking with Liz Tennant with Wise Up and doing some other research online, is that there are a lot of resources, but they duplicate their efforts. And a lot of times the left hand doesn't know what the right hand is doing, so there's not really a clear connection and collaboration with these different sectors. Also, it's really hard to get a handle on the magnitude of the problem, who is involved, how, what are contributing factors, etc. So really there needs to be a community assessment done that needs to be accurate and comprehensive, and is part of that 5-year grant with Wise Up. And developing the research methodology to do this is a bear, and that is a big weakness, is coming up with a really good research method that's going to assess this. And once you really need to have that assessment done to provide any interventions, any support, anything that would be downstream of that. So also a weakness is that there need to be more strategies to provide community outreach. Also how to get surveys to uncover the magnitude of the problem. You need to make sure these surveys are representative, they're at different venues, and that they're effective in really identifying what's going on, and are well designed. And then from that, there can be an action plan that needs to be deployed to curtail the problem. Also, forums are important because they bring knowledge, they help educate the public, they dispel myths, and they become an open arena. So if there are people that have biases or false ideas, we need to have forums that will help address that, because that's will help provide support in the community. Okay, so more weaknesses specific for American Indians. So my research on American Indians, we found that there are 8 tribes within the state and affiliations. And I'm going to show a map here, but in a minute. However, there are no tribes or affiliations near Rowan County. So youths that are in our target age group may feel disenfranchised because there isn't really a local community support group where they can go to basically have their social needs and met and feel connected. Okay, so they might, even though they're ethnic minority, they may not have the social support they need. And so basically, even services like Wise Up, they even mentioned that they did not their reach and scope did not really cover our American Indian population, and they didn't know how to reach them. So that could be an issue. And here's a map of the different tribes and American Indians in North Carolina. I work in Guilford County. I live to the left of it in Forsyth County, and then below is we have Rowan County. So it may not be such that American Indians in Rowan County would go to like Guilford County to get outreach and support. So from this survey, we looked at community health diagnosis, and basically we identified the top health issue for our target community of American Indian youths ages 12 to 18 is prescription drug abuse. Okay, so we looked at how to formulate a community diagnosis, and before we did that, we had to define what it was or find out what it was. So according to the World Health Organization, it is a quantitative and qualitative description of the health of citizens and the factors which influence their health. It will identify problems and propose areas of improvement and stimulate action. Okay, our community diagnoses, basically we've identified 3 top priority diagnoses. Okay, poverty, lack of education, and decreased access to mental health care. So 21% of the American Indians in Rowan County are living below poverty, and that's a big factor. and putting them at a disadvantaged group. And also, Rowan County itself, basically, most of the residents have 83% are only at high school level of education. We were not able to find specifics for American Indians because part of this information is just hard to get, hard to get the survey and to get the methodology to find those statistics. So I think that is actually just for Rowan County itself, but that shows that they're not really a highly educated populace. Also, we did find that mental resources are limited, especially for Native Americans. And Rowan County is a rural area, and so basically these areas are highly affected by the epidemic. And also because we think that the American Indians don't have a lot of social support, they are at risk. So from this, we have our community health diagnosis. We came up with primary, secondary, and tertiary interventions. Primary interventions are geared to basically preventing addiction from happening. So they, stop it before it occurs. And so we identified that providing education in schools, helping create forums for middle school and high school kids, and implementing programs on how to cope with life are big primary interventions. Next, we looked at identifying secondary interventions. So basically, this can occur, it didn't halt the addiction from starting in the first place, but it can prevent it from, being more of an issue. We would say that access to primary care physicians for physicals, as well as nurses with identifying and screening for misuse. So it's very important, as I mentioned before, that in order to stop abuse in its tracks, to say, well, oh, you've had a shoulder injury. You can't be on you can't be on narcotics for 6 months. We have to stop this at 2 weeks, and to recognize early that abuse might be going on. And so implementing community programs will also help. Tertiary interventions is aimed at recovery. So for example, we have Narcotics Anonymous, also ways to taper off abuse, like methadone would be very useful. Okay, so the strength of the citizens of Rowan County is that residents value family and community. So there are regular Narcotics Anonymous meetings that are great. And the only thing that I might be an opportunity to look at for the county are those groups inclusive of our target population? Do they welcome the Native Americans? And do the Native Americans within Rowan County, do they know about Narcotics Anonymous so they can seek help? Okay, so in conclusion, Rowan County has a disproportionate rate of the drug abuse in Native Americans, even based on its relative small size. They have the highest rate of unintentional overdoses and deaths of all other races, and a very high poverty rate, which would place them at risk for prescription drug abuse. So, based on our assessment, Rowan County has some significant gaps in healthcare, and we've identified the top 3 community problems for Rowan County, specifically for Native Americans, are poverty, lack of education, and decreased mental health care access. High poverty rates combined with lack of mental health resources and limited educational opportunities are a key factor with our current opioid epidemic with the most vulnerable populations in North Carolina. So after we performed our assessment, identified complex problems that are in the community, including the prescription drug abuse, struggles with affordable and accessible mental and physical health care needs, and health education. And we did look at the strengths and weaknesses of our community. Our current knowledge and future nursing practice will be influenced by what we learned. So what we learned are basically what are the right questions to ask when working with our patients, and basically how to look for answers to these questions, and how to engage community members, and basically survey resources. And we would like to increase community health awareness as part of our practice, and help with ways that we can understand, shape, and educate the communities in which we serve. And here I do have some references from the side material. I do hope that you found this talk to be informative, and do appreciate your attention.